All right, it is officially 12:01, so I can say good afternoon and welcome everyone to the American Lung Association in North Carolina Community Connections, presented today by Novant Health. My name is Lauren Love, and I'm the Executive Director for the American Lung Association here in North Carolina. And I will be your host for today's session. So, before we begin, a few housekeeping items that I want to share. So, first of all, this webinar is being recorded and will be available after the session. If you need to jump off early for any reason, you will have access to it later. Also, throughout the session today, please submit questions for our expert through the Q&A button. So if you simply click on that button, you'll be able to submit any questions. And we're going to be doing our best to make sure that we can get through all of those questions by the end of the session today. Also, we encourage each of you to complete the survey that will pop up in your browser once we end the call today. Today's discussion will focus on learning about asthma. We are very fortunate to have an amazing expert joining us today to guide us through this discussion. Joining us today is Dr. Alexis Smith. Dr. Smith is a pulmonologist at Novant Health, and she works out of several locations in the greater Charlotte area. Dr. Smith has extensive experience in asthma treatment, chronic bronchitis, COPD, lung cancer, lung nodules, and pulmonary hypertension. Welcome, Dr. Smith, and thank you so much for joining us today.
Thank you, Lauren. Nice to see you. My camera shut off and I'm trying to turn it back on and it says I need the host to do that. So I'm not sure if that's an accident on my end, but it's so nice to meet you all and I'm thrilled to spend this time with you. I know how precious your time is. Hello. To
There
talk a
you
little
are.
bit about asthma. Thanks for having me.
Yeah. Well, when people registered, they had an opportunity to submit questions. So we're going to start off and open the conversation with some of the questions that were submitted during registration from our audience.
Perfect.
So we'll start off with, kind of giving a basic overview of asthma and specifically what are the primary symptoms that represent asthma?
Oh, that's a great question. Thank you all again. So, asthma is what we like to call a reactive airway disease, which means as the patient, your friends, your family, me, as we interact with our environment and we breathe the air that we breathe, our lungs can become kind of twitchy or reactive to our environment. And what patients may feel is a chest tightness, sometimes a shortness of breath. They may hear themselves cough at the end of a breath and they may hear some wheezing, which is sort of a little bit of a high pitched noise. Now, asthma is related to the air that we breathe and the different triggers that a patient may encounter. And so sometimes that has to do with things like pollen and allergies and the environment. So, for instance, I have an allergy to cats. So, if I get around cats, you may hear some wheezing and some high pitched noises as I start to breathe. Other times, patients may have triggers that they don't necessarily know. And so, some of them are very clearly outlined and some of them aren't. But what we know is that most patients who have asthma will get that chest tightness, some shortness of breath, even a cough that can be worse at night. And that's one of the triggers or hallmarks that we think of when we're talking to patients. And that's because all of us, men and women, have a hormone that can sort of constrict the airways while we're sleeping. And there's a few other things that are happening to the airways. So the wheezing may be worse at night, the coughing may be worse at night, and it actually can wake people up from sleep. So they'll be absolutely asleep and wake up because they're coughing or because they're wheezing or short of breath. So these are some hallmark features that you may hear or feel as a patient with asthma.
Thank you for that overview. So, what are some good tips to living with asthma for adults and children with asthma? And this is kind of a two-part question. So, is there anything different that you would recommend for asthma patients during different stages of life?
It's a great question. So, what's important when you're living with asthma is to know how to manage it. So, typically, when we're talking about asthma, we try to explain what and work with patients to try to understand what their triggers are. Like I said, for me, I have trouble with cats. Some people may have allergies that may be fall allergies or spring allergies or any number of triggers. Some people have trouble with dust, and so spring cleaning can get them. And then sometimes it's immune mediated or environmentally mediated. And so, what's helpful is to try to understand your triggers. And the more time you spend living with asthma, the more you get to understand your triggers. And then to be gentle and gracious with yourself, because there are times when you have a trigger that we didn't quite know was on your list that now becomes that. And so that's okay too. One of the things that we know is that there's lots of different ways to treat asthma. So some people only have asthma symptoms when they're exercising or exerting themselves, and we call that exercise induced asthma. So for instance, when I was living in Chicago, when I would go for runs and it was very, very cold, that cold air can start to constrict your airways and you'd start wheezing or coughing there too. And so, what we do for those patients is just give them a rescue inhaler, something to use as you need it, but not every single day. And the expectation is that you won't need it all the time, just when you need it. Then some people may need to step up from that and use a variety of what we call maintenance inhalers designed to sort of calm down inflammation and stabilize those lungs throughout the day. So you would take them regularly. Some are twice a day, some are once a day. And then there's even step up therapies, even injections that we can start to use to calm down asthma. So, one of the best things to do when living with asthma through all stages of life is to understand your asthma action plan. This is something that you're going to work with your primary care physician or a pulmonologist to outline what do we do when our lungs are feeling great? What do we do when we're not feeling so great? And then what do we do when we're feeling absolutely badly? And that action plan dictates what to take when and when to call and ask for help. So it's important for you to understand your symptoms, know where you fall on your asthma action plan, and involve that into your friends and family so that if you're out somewhere and things start to get a little uncomfortable for you, they know how to help you as well.
Thank you. So, this, I believe, is coming from a physician or a provider perspective. Have there been any updated or recent shifts in the quote best practices for asthma?
Yes, there are. That's a great question. There are lots of different guideline changes when it comes to asthma. And so, like I said, there's rescue inhalers, then there's maintenance inhalers, and then even a step up, these injections underneath the skin to try to help asthma as well. And there's lots of different research and different technologies going toward that. But one of the things that we know is that our two major guidelines called GINA guidelines or NAEPP, these are just two societies that study asthma regularly, are starting to look at the way that we use our rescue or our short acting inhaler, that as needed inhaler, and what's best to use there. So they're looking at sort of all three of those phases and what's best to use when. But certainly the conventional use your maintenance, your everyday inhaler at regular intervals, use your rescue when you need it. And then if we even need to step up further from that as far as injections, these are some things that we have as well.
Can asthma occur or develop because of chemoradiation treatment for lung cancer?
That's a good question. So, asthma as a diagnosis can a little bit be on a spectrum. Like I said, it's a reactive airways disease. I don't often see it as a consequence of radiation after a lung cancer. I will see a cough after radiation because sometimes that radiation beam can start to affect the lungs and cause some scarring called the pneumonitis. But rarely does asthma itself and the entirety of asthma occur after that situation. More commonly, you can see an asthma like presentation after a cough, after a virus, I'm sorry. So if a patient develops flu or even RSV or COVID, in that post viral setting, they can have reactive airways disease where their sinuses are bothering them. They've got lots of cough at the end of expiration and even some wheezing. That may require an inhaler, a maintenance inhaler, to get through that post viral period. But I rarely see it after radiation from a lung cancer.
So moving on, we received several different questions about treatment and therapy of asthma. So this one specifically is focused on over-the-counter medications and supplements. So would you share with us some of the side effects that can sometimes come with those types of treatments?
Sure. So, lots of times when we talk about over the counters, we're trying to calm down allergies um, and approaching it from the allergic standpoint, not so much the inflammation standpoint. So, in pollen season, you might have sinuses dripping and draining back, affecting the vocal cords, which then can start to clamp those lungs and have a reactive spasm, if you will. So, trying to shut that pathway down with over the counter is something like an antihistamine. You may hear things like Claritin, Allegra, Zyrtec. These are just common ones that you may see or hear. So those are going to be good medications to use. They can also come in a decongestant version, the Claritin D, if you will. That decongestant version is going to do a really good job of drying everything up, but it may raise things like blood pressure. So you have to be worried if you're also on an antihypertensive medicines, watching things like blood pressure in that setting. In general, those are pretty safe, but you want to be mindful of blood pressure monitoring in those settings.
Good to note. So, are there any promising treatments or cures on the horizon for asthma that you are particularly excited about?
Absolutely. So that's a really good question. There's a lot of really hot topics in science to say, can asthma as a symptom, as a syndrome, actually be cured? And one of the things that we know is that in people who have really bad asthma, who need their maintenance inhalers and are still using that rescue very frequently, and then we move to those injections, sometimes those injections can work so well that people stop to take their other medicines, which is not what you want to be doing. You want to stay on all of those step up therapies. But that does lead to the question, can we actually cure asthma with these what's called biologics? And again, those biologics are approved for a very small subset of people who have really debilitating asthma, who are going into the hospital regularly, who are needing oxygen regularly, and steroids regularly. So I don't think that there's a cure for asthma as a whole on the horizon, but perhaps in a subset of people who have really debilitating asthma, we have some longer term options than just inhaling every day. Hope that helps.
That does help. And on a related side note, the Lung Association, one of our most important pillars is research on asthma and other lung diseases. And here in North Carolina, we're currently funding 4 studies, and 2 of them are focused around asthma. So I'd encourage everyone to look at lung.org and see some of our research priorities here.
Perfect.
So this question came in. What are your thoughts about the NIH's guidelines around smart therapy? So if you could, before you answer that question, give just a brief explanation of what smart therapy is.
Sure. So SMART therapy stands for single maintenance as rescue therapy, which basically means that maintenance inhaler that you take once or twice a day can be doubled and used as a rescue. For instance, if I'm on an inhaler twice a day that suppresses the inflammation of my lungs, there are some studies out there that have very exciting data to suggest that you could also use that as your rescue instead of a separate whole inhaler to try to rescue. Now, unfortunately, the smart therapy is a fantastic set of data, and it really does show that it works because that maintenance inhaler has some long-acting medicines that can sort of suppress that inflammation and really do great job. It's not FDA approved in the United States, and so we've had some problems with crossing that data and extrapolating that here when it comes to insurance. So for instance, there's a medication called Symbicort. It's a combination medicine that we use twice a day, 2 puffs twice a day to decrease the inflammation and control asthma. And one of those you can use as a rescue in another country. It's not approved here. So we do have some excellent data looking at other forms of rescue inhalers that have combination in them and are approved in this country. That information came out about 5 months ago. So we're starting to relook at how we use rescues to not only open up the lungs and make them really big and get all that air in, but also have a combination that decreases that inflammation as well as a combination therapy. So SMART is a really good, well adopted way to use the maintenance also as a rescue. We have some trouble with the United States and getting it covered in things on a granular level. We want to make sure that what we prescribe can get to our patients without cost prohibitive problems. And so now there's a new inhaler that relooks at the way we look at rescue, and that's something that's on the horizon as well.
It's promising. Just as a quick reminder to everyone, you can submit a question through the Q&A box. I see we have a couple coming in. So just as a reminder before we can hopefully squeeze those in here. So another question that was submitted ahead of time, we know that asthma, impacts the body far greater than just the lungs. This question asks specifically, how does an asthma attack impact the rest of the body?
Yeah, so that's a good point. So what we like to do is try to keep our asthmatics on a nice even keel with their respiratory status, but many things can tip them. Stress, allergies, the environment, all different things can tip them into into really feeling poorly and having difficulty breathing. What we know is when patients are having an asthma attack, we call that an exacerbation of asthma. And that can even range into something that they can control just with their rescue. Sometimes they need some steroids, so pills by mouth to try to decrease inflammation. And sometimes they need to go to the hospital. But what some data looking at what's actually happening during an asthma exacerbation or an asthma attack that we are finding now more than we knew ever is there's some mucus plugs that can plug up the lungs and the airway, making it very difficult to breathe. And so the body is seeing a difficulty in breathing, trying to sort of we're trying to open that up with short acting rescues, with steroids, even with oxygen, and that's what we're seeing from that systemically. If a patient is without oxygen for a long time, we're hoping that this doesn't happen and that we can reverse this very quickly. You can start to see different effects on other organ systems if they've been without oxygen for asthma for quite a while. So you may see some kidney problems, you may see some other organ issues. But with all of the excellent treatment that we have for asthma and the availability and the readily available to our patients, those are very few and far between that someone would have, end organ damage from such hypoxia of asthma.
Let's move on to some of the questions that were submitted so far in the Q&A. So is there a risk that my asthma will worsen with age?
So great question. Asthma is typically, it's something that will continue with you for life once you have your diagnosis, but there can be long periods of just very calm symptoms of an asthma. And the more that you know your triggers, the more that you can avoid them. So there isn't anything that would say that as we age, asthma will get worse. In fact, we know a little bit more about our lives, ourselves, our bodies, and can start to avoid things like our triggers as we age. So there's no indication that your asthma will worsen as you age.
With age comes wisdom, right? Do you recommend a diet of any specific foods to help with asthma? Are there any foods that you would recommend that your patients with asthma avoid?
That is another excellent point in science, actually. So what we know is that there isn't a direct correlation between the foods that we eat and asthma. There are some diseases that are affected by the things that we eat. What I would say is, if you are allergic to anything, that allergy can trigger an asthma attack. So if you're allergic to peanuts, that's not something that you're going to want to be eating because you're going to get into lots of trouble. And one of them can be constriction of your airways. But there's no specific diet. Now, there are patients that I've had who felt that joining anti-inflammatory diets and changing their diets in that anti-inflammatory pathway can really help with asthma. But I don't know that I know any specific literature. I do know that as our body weight increases, and specifically different distributions of fat, or what we call adiposity, that can worsen asthma symptoms. So anytime that we're trying to focus on our diet, lead healthy lives and exercise and appropriately caloried diets, our asthma is going to get better.
Well, we actually have a question specifically around exercise, so we can transition to that. Are there any types of physical activity that you recommend for asthma patients more than others?
I think making sure that you have an excellent cardiorespiratory, so cardio workouts are really important. Just general movement, the way that you can move and interact with your environment, move your lungs, get good air in there. Any movement is great movement for asthma.
Great. Good to hear. Get those 10,000 steps in.
Exactly. So I'm short on today. We got to get
Yes. All right. So this person wrote in, please advise if asthma diagnosis is permanent for life. I was diagnosed 7 years ago and use an inhaler once a day since then. I'm currently breathing well with only intermittent mucus aspiration from the lungs a few times a week.
So asthma is a diagnosis that sticks with us. That's why if our children are diagnosed, as pediatricians, you may want to talk to your pediatrician, but they don't like to diagnose patients with asthma early because that stays with them. And sometimes kids can kind of grow out of these things. But once you have a diagnosis of asthma, it does stick with you. Now, there can be times where asthma is sort of loud and noisy, and there's other times where it's quiet. And what we're trying to do is keep you on things like that maintenance inhaler to keep symptoms nice and quiet, so that even though you have asthma, you're not interacting with it or dealing with it very much. It's sort of just in the background and everything's going okay.
All right, we had 2 more questions just come in. Is seasonal asthma real? And if so, what's the cause?
So yes, seasonal asthma or exercise-induced asthma even, these are kind of on the continuum. So That plays a lot of role in allergies. So as we interact with our environment, our sinuses take in allergies, start dripping and draining, drain back here and start to cause spasms, and that's asthma. So really taking care of our allergies are really important. Taking care of your sinuses. I typically have patients do a nasal saline wash, sometimes nasal sprays to calm down any drainage from above, so that we can sort of keep the asthma, that the lungs as calm as we can. I think of it as a chain: the sinuses, the vocal cords, any reflux, and then asthma. If we don't control here, the asthma itself won't ever get really controlled.
Would you please explain how to use the air quality color code and what it means to both people with asthma and those without?
It's a good thing to think about. I think that the my iPhone certainly tells me what the air quality is as well, and that's sort of a new situation. Certainly, we saw a lot of this with Canadian wildfires and even forest fires in our area as well. And it's a measure. I don't know specifically the algorithms that go into how they determine the colors, but it's a measure of the quality of the air that we're breathing. And for asthmatics, it can be a problem. So when we start to see that the air quality is poor or it's moving from a green to a yellow, you might expect that your friends and family who have asthma may be using their rescue inhaler more. It's definitely going to be something that you want to make sure they're on their maintenance. Because oftentimes when we're doing these things, and like our last questionnaire, when we feel well, sometimes we'll forget to take our medicines because it's been so long that we needed them and we were doing so well. But it's in those times that we really want to stay on top of our regimen and then use our rescue if we need to.
What would you say are the three most important actions to take right now, today, to have a better quality of life while living with asthma?
That's an awesome question, actually. So, number one is open communication. So, with your friends and family, you're going to want to tell them that you have asthma and what you do to control it. So, you're going to want to know that you're on your maintenance and that this is what my rescue inhaler looks like. You know, if you're going to a concert and you want to make sure that that's in your bag or your purse or in your pocket as you go to these different events, so that in case something happens, you have a rescue and your family knows how to help you as well. Um, Exercise is incredibly important. The healthier you stay, the healthier your lungs are. And then making sure that you understand your triggers and giving yourself some patience, because sometimes we really know what our triggers are, and as we start to age or move across the country or experience different stressors, we realize that our asthma can fluctuate, and that's okay. Some things we can control and some things we can't. It's about an ever-growing process of learning our lungs and our body as we interact with the environment.
This is related to some of what we've been talking about so far. How does climate change and the air pollution cause an increase in asthma? Would you say that it's more impactful in children with asthma?
So I'm not a pediatric pulmonologist, and I certainly welcome you to have one on for your next session here. But what we do know is that pediatric asthma can be affected by lots of things. As with adults, air quality, the environments that we live in, how many people live in the home, how close are we in living quarters with each other. Um, and so as we start to, as the earth starts to warm, as we start to interact with different pollutants and smog, patients with asthma can have trouble. And so it's important to keep your maintenance inhalers on, keep communication with your friends and family as you're interacting with them about how to use your rescue and things like that.
Had another one come in, and thank you to everyone who has submitted questions so far. This person says, I was diagnosed with asthma in my late teens when I was smoking about a pack a day and living with other people who smoked. Since then, I have quit and live in a smoke-free environment and have not needed my rescue inhaler for years. Should I continue to fill my rescue inhaler prescription?
That's a really good point. So there are times in smokers that their breathing tests and even their lab work can look like asthma, and it has a lot to do with their smoking and the environment that we're breathing in. If you haven't used your rescue inhaler in years, it either means that your asthma is very well controlled and you're not among any triggers, or you may want to go get another breathing test and get another evaluation to see, do you really have asthma, or were you triggered by all of the environment you're breathing in? Because the reality is those rescue inhalers can sometimes be expensive. And so I hate to have patients continue to renew them for decades and decades if they haven't used it even once. So it might be a good idea to revisit this with a pulmonologist, get a set of breathing tests, get some new labs, and really discover, do you still have the necessity of a rescue inhaler like that, or have you not needed it anymore?
Related to that, we just had a question come in. I've heard that using a rescue inhaler as a maintenance inhaler is not the best approach. Is that true?
So the rescue inhaler as a maintenance inhaler, I want to make sure I'm thinking this clearly. So if you're using your short acting, your rescue, that's really only going to last you about 10 to 15 minutes. That smart therapy is different. That's using your maintenance, your twice a day, as additionally as a rescue when you need it. But using just your short acting is not going to last you long enough to get maintenance or stability of those lungs. If I'm understanding the question correctly.
Yes, I believe you did. Okay, one more question just came in. Some observational studies suggest that vitamin D is protective against asthma exacerbation in children. Does vitamin D deficiency exacerbate asthma? Thoughts?
Great question. A vitamin D is sort of this. It's going to be in a lot of studies that helps lots of things. It helps with weight loss. It helps with mental status. It helps with sort of a cofactor for many other different problems. So, vitamin D is always good to stay up on and supplement if you're not available to get a little bit of sunlight now and then with sunscreen. Uh, but I don't know of any particular studies that talk about a threshold level for which asthma would then be worsened or at risk for exacerbation. And therefore, it'd be difficult to say at what level we need to supplement, right? And so I'm not sure of those studies that tell me an exact threshold that I need a vitamin D level at. I just think it's a pretty good idea that I personally take a multivitamin. It has vitamin D in it, and I do my best to exercise and stay outside when I can in a safe, sunscreened environment.
Sunscreened environment. I like that. Um, it looks like we have one more question, and this might have to be our last one for today, so we can end on time. Most inhalers are prescribed to be taken every 4 to 6 hours. In the event of an emergency, how often could an inhaler be used safely?
So that is the prescription that we would use for a rescue. So your maintenance is going to be once or twice a day, depending on the formulation. And that rescue or crisis inhaler is going to be prescribed every 4 to 6 hours as you need it for wheezing, shortness of breath, or cough. And the good rule of thumb, and this may be on your asthma action plan, is if you're needing that as it's needed, so every 4 to 6 hours, if you need to reach for it again, that's an appropriate time to call your pulmonologist or your primary care doctor. Because my goal in keeping a maintenance inhaler on is so that my patients may reach for their inhaler, their rescue, once a week, maybe even once a month. But if you're needing it at the end of that every 4 hours or 6 hours, there's something going on that 10 minutes of rescue maybe just isn't giving you enough of. And so we may need to increase your maintenance. We may need to give you some steroids, but that's a pretty good indicator. If you're using it right as it's directed every 4 hours as you need it, and you're needing it every 4 hours, that's an indication that we could get you some better help.
Thank you so much for all this information today. Looks like we don't have time. There's one more question, and we'll go ahead and answer that offline for that person that submitted that question. So before we conclude, we want to share some important resources that are coming on your screen here. The American Lung Association is committed to supporting those impacted by all lung diseases, and we are so proud to partner with organizations like Novant Health to bring information and awareness around asthma, as well as other lung health topics. For more information, please visit the websites that are listed on your screen, and also consider contacting our lung helpline to find about resources that we offer here at the Lung Association, as well as the resources that exist in your area. This has been such a great conversation. So again, I think there might be now 2 questions, and we will get back to you, someone from our staff, within the next week with the answer to your question. So thank you all for attending today's Community Connection. I hope you found it informative perspective. A special thank you to our presenting sponsor, Novant Health. And we are so grateful to our expert, Dr. Smith, for being here. Our next Community Connections in our virtual series, which will also be presented by Novant, will be focused on tobacco cessation and will be held in August. So please stay tuned for more information to come on that. Also, friendly reminder, please complete that survey that'll pop up in your browser at the end of the call. Your feedback is very important to us. And within a week, you will receive an email with a recording of this session, as well as some additional resources. So thank you again to Dr. Smith and to each of you for joining us. I hope that you all have a wonderful day. Thank you.
Thank you.